Recording.
Hi, I'm Larry Musto. This is my informative speech for week 2 on PTSD or post-traumatic stress disorder. And this is my audience.
Okay. I hate showing my face.
Imagine yourself a soldier deployed in the Middle East, out patrolling a Providence. As you begin to walk down a side alley with your team, you get a gut feeling something is about to happen, but you don't know what, and then it hits you. You and your team have just been attacked by the local terrorist group. As you're firing your weapon at the enemy, you look over to see your best friend catch on fire, and you are unable to stop the flames, screaming while you are unable to do anything to help him. After returning to the forward operation base, you begin having nightmares and constant flashbacks of watching your teammate. These nightmares last for months. What I just described was an example of post-traumatic stress disorder, also known as PTSD. Post-traumatic stress disorder is a psychological disturbance lasting more than 1 month following stress that would produce anxiety in anyone who experienced them. In the following, I intend to give a brief history of PTSD, the diagnosis stage of PTSD, and inform you of the different treatments for PTSD. For centuries, PTSD has been around, but until the APA, American Psychological Association, officially recognized the disorder in 1980, PTSD would in some cases go untreated. Some doctors and healthcare professionals feel even today the disorder is not real. They consider it to be a lack of courage or personal weakness. In history, PTSD has been known by many names even before its entrance into the APA, including World War II, battle fatigue or gross stress reaction, World War I, combat fatigue or shell shock, the Civil War, soldier's heart. Although disregarded for decades, the Vietnam War brought significant public attention to the disorder when doctors began to diagnose it as post-Vietnam syndrome. The veterans of this war who suffered from this disorder pushed the medical and military community to recognize it. Diagnosing PTSD can be difficult for healthcare professionals. With most disorders, tests can be done to diagnose it, but with PTSD, diagnosing is based on the preliminary symptoms. If not properly diagnosed, PTSD can go untreated due to some symptoms can closely be related to other disorders. PTSD can occur at any age. Beginning signs of PTSD fall into 3 main categories. 1. Reliving, events which disturb day-to-day activities. 2. Avoidance, emotional numbing or feeling as though you don't care about anything. 3. Arousal, difficulty concentrating. Other side symptoms include feeling guilty about the event, survivor's guilt, agitation, dizziness, fainting, feeling your heartbeat in your chest, headaches. PTSD can also cause other problems including alcoholism. Diagnosing can sometimes also be difficult and the person is unwilling or unable to discuss the traumatic event, making it accurate diagnosis difficult. Treatment for PTSD has a wide variety that is available to people in need of it. The treatments include cognitive therapy, exposure therapy, eye movement desensitization and reprocessing, SSRI medication, acceptance and commitment therapy, psychodramatic psychotherapy, and behavioral activation. Cognitive therapy involves a therapist helping you to understand the changes you are experiencing and the way you think about the trauma and the effects it has on your day-to-day life. Exposure therapy. The therapist has you focus on how not to fear the memories of the event. This type is based on the theory that people learn to fear your thoughts, feelings, and things that trigger remembrances of the trauma. Eye movement desensitization and reprocessing, a type of treatment for PTSD that involves focusing on other stimuli while you are discussing the event, such as eye movement, hand taps, and sounds. SSRI, or selective serotonin reuptake inhibitors, are a medication therapy that is prescribed by healthcare professionals. Medication helps your body produce certain neurotransmitters that your brain may not be producing efficiently, such as serotonin. ACT, or acceptance and commitment therapy, is based on the idea that the patient's suffering comes not from the experience but from the attempt to avoid. Psychodramatic psychotherapy approach is a PTSD, is to focus on numerous different factors that can lead up to PTSD, such as early childhood experiences. The last is behavioral activation, where the goal is to increase the activity levels and to prevent behavior that triggers the avoidance. There are still many other forms of treatment yet to be discovered, tested, and recognized by the psychiatric community. Today, about 7 to 8% of the general population will develop PTSD. These numbers go up significantly for veterans and rape victims, among whom PTSD has anywhere from 10% to 30% chance of developing. Currently, the statistics for Middle East military operations claim that while less than 10% of the general population will develop PTSD, 1 in 6 soldiers returning from Iraq suffer from PTSD. Enlisted men are twice as likely as military officers to report PTSD. American women serving in the Middle East tend to suffer from more severe and disabling forms of PTSD.